Hello everyone, Dr. Mark with you again, and today I wanted to discuss a frequently asked question about whether to get dental care for a senior dog. The person who sent the question mentioned that her Shih Tzu is 12, has some minor health problems, but also has dental problems and is in need of a cleaning. Her veterinarian wants to clean and polish his teeth to remove the infection underneath the tartar buildup, but she was worried about putting him under anesthesia at his age. She wanted to know if he was too old. Any dog of any age can have problems with anesthesia, but there is definitely more risk as a dog gets to be a senior. A tiny percentage of dogs can die under anesthesia no matter how many precautions are taken. Yes, there is a risk. That risk is very small, however. Estimates vary, but it is much less than 0.2% for all dogs that are put under general anesthesia and not much more for seniors. One study done in the UK estimated that even though senior dogs had a higher risk, it was still less than 2% of dogs that had complications from anesthesia. Though the risk is low, there are some things you should do to make the tooth cleaning procedure even safer for your dog. The first thing you can do so that your dog is safer under anesthesia is the veterinary visit and physical exam a week or two before the procedure. If your dog has any abnormality in the exam, like a murmur or erratic pulse, the veterinarian will want an echocardiogram to get a better idea about conditions in the heart. They may also want to do X-rays. The second thing I would definitely recommend would be to have blood work done before the surgery. This used to be optional, but many practices will no longer anesthetize senior dogs if blood work is not done beforehand. The majority of dogs who die under anesthesia have a serious underlying health issue, like liver disease, heart disease, or kidney failure. Blood work can find an infection and any internal organ problems even before there are any clinical symptoms. It will identify many issues before anesthesia, and if you have had this done in the past, your vet can look for any changes. It is worth paying to find out about any problems beforehand. Although there will be an additional expense, the third thing you can do to reduce the risk is to agree if your vet wants to put your dog on fluids during the procedure. If they do not ask, you should request this be done even if there is going to be an additional expense. Senior pets can be fasted just like younger dogs, but water should only be taken away about 20 minutes before pre-anesthesia. Since even healthy seniors are more likely to become dehydrated, this helps a lot to reduce the risk. If your dog is on fluids, he will have a catheter in place and can even get fluids after the surgery until he is eating and drinking normally. The fourth thing is to make sure your dog has a pulse oximeter in place during the dental. Almost all veterinary clinics also use the pulse oximeter to measure the oxygen level during the procedure. The gas used in general anesthesia is relatively short-acting, and if the oxygen levels in the blood fall quickly, indicating that the dog is not breathing often or deeply enough to get oxygen to the brain, the veterinarian or veterinary nurse will turn off the oxygen and allow the dog to wake up. You can ask about this and make sure it is going to be used. There is no way anyone can guarantee that surgery is 100% safe. Adverse effects during anesthesia are so rare, however, that they should not be your primary concern. Your main concern should be the negative effects of not cleaning the teeth. The veterinary dentist will clean underneath the gums and remove any pockets of pus. About 90% of senior dogs have periodontal disease, and breeds like Shih Tzus are even more prone to dental disease because of their crooked teeth and underbite. When your dog eats or chews on a treat, the pus from underneath the gum line is released into the bloodstream, resulting in problems with the heart, liver, brain, and kidneys. The bacteria released during eating move through the bloodstream and can develop into a heart infection, bacterial endocarditis. Liver problems happen when the bacteria are filtered out by the liver, and they then destroy liver tissue. Your dog might also develop a brain infection, encephalitis, but heart disease is much more common, and finally the bacteria in the blood are ultimately lodged in the kidneys for removal and can lead to glomerulonephritis, a kidney infection that can lead to kidney failure. A study of older dogs found a significant level of heart disease in older dogs secondary to periodontal disease. It is safe to say that if your dog does not have heart disease, and the dental infection is not treated, your dog will eventually develop an infection on the lining of the heart. Ultimately, this has to be your decision. If this were a senior dog and you were told that he needed surgery for a cosmetic reason, I would say it is not worth putting him under anesthesia. Having the teeth cleaned is not a cosmetic procedure. Based on the likelihood of problems from anesthesia compared to the likelihood of problems from leaving the teeth infected, I think you should go ahead with the cleaning. Thanks for watching. If you have any questions about your senior dog, you can leave a message here or send a more detailed question to my Ask a Vet column at yourpetsathome.com. Please be sure to add the dog's age, sex, and breed. Give as many details as possible, including the result of any tests you have had done. If you are still here, take a minute to look through the videos on my profile page and see which ones can help your dogs. There are important videos on nutrition, skin care, choosing a new dog, and some are just fun videos on dog care.